All right, those heading up the fight against Ebola in Dallas and the United States were on the hot seat today. A congressional hearing in Washington, D.C., and the committee wanted to know the whys and the hows of everything we've been seeing happen here happen. Why so many mistakes? How did so much go wrong with the first Ebola case in the United States? Fox 4's Sean Rabb watched the hearing and joins us now live from our Dallas newsroom. Sean.
Yes, Steve, strong words and a stern tone from members of Congress who made it clear they were not happy with what's happened surrounding this Ebola outbreak here in Dallas, and they were looking for answers.
CDC and our public health system are in the middle of a fire.
And the flames of skepticism fanned by members of Congress.
We have been told, quote, virtually any hospital in the country that can do isolation for Ebola, unquote. The events in Dallas have proven otherwise.
We made mistakes. We did not correctly diagnose his symptoms as those of Ebola, and we are deeply sorry.
Apologies did not appease the committee, who wanted answers, like how Amber Vincent, the second nurse to get Ebola, got on an airplane with fever and the blessings of the CDC.
Did she, in fact, call the CDC and ask for guidance on boarding a commercial flight, as far as you know?
My understanding is that she did contact CDC, and we discussed with her report of symptoms as well as other evaluation.
Were you part of the conversation?
No, I was not.
And why is the first nurse to contract Ebola, Nina Pham, now being transferred for treatment to the National Institute of Health's biocontainment facility in Maryland?
So is the reason that she is having to be removed because the personnel are no longer willing to stay at Presbyterian to take care of her?
Texas Presbyterian is really dealing with a difficult situation. They're working very hard. Because of the events of the past week, they're now dealing with at least 50 health care workers who may potentially have been exposed.
Has her condition deteriorated or improved?
No, it's not. From the report that we're getting from our colleagues in Dallas is that her condition is stable and she seems to be doing reasonably well.
I still don't feel like we have a good answer of why Nurse 1 and Nurse 2 contracted Ebola.
We don't yet know precisely how or when they were infected.
It was, Steve, 4 hours up against the wall for those answering questions today, especially for Dr. Frieden. Now, the committee clearly not satisfied with what they heard, not getting the answers or the assurance they were hoping for.
Yeah, Sean, there was a lot of scatter shooting, a lot of criticism, and 4 hours of it. I watched it too. But I think that last sequence that you just played is kind of the most telling. Nobody can say how those two nurses got infected. I know that's bothering the nursing community who you've talked to.
It is certainly bothering all of the medical community, and it was on the minds of all of the panelists in this committee hearing today. They wanted to know how if they were wearing CDC-directed protection, how could Amber Joy Vincent get sick, first of all? Second of all, how could she get on a plane and leave here and then return here when she had been exposed, part of a pool who had been exposed to Thomas Duncan? There you see her last night making that trip to Atlanta. And then they wanted to know about Nina Pham. How is it possible, they are supposed to be the best at what they do, they're well trained, how then could they contract this disease? And no one able to give them an answer today from the CDC or from folks at Presbyterian. Dr. Varga could not answer their questions today, and they were not happy with that.
Right. It was also interesting. We got to move on, but Frieden continued to say Vincent didn't have any symptoms when she got on the plane.
Exactly.
But she's 99.5.
Low-grade fever.
A lot of people think that's a symptom, but he's still saying not by the standards. So we'll see. We'll see how this will all play out, Sean. Things are changing. Thank you.
Okay.